Hello and welcome to part 2 of our motor speech disorder project. I will be presenting for our group and we have a PowerPoint. So what is dysarthria? Dysarthria is a motor speech disorder that is characterized by slurred and unintelligible speech resulting from an inability to control or coordinate the muscle movement of the mouth. This means that a person with dysarthria is typically speaks slower, more slurred, and they also experience problems with the overall loudness and quality of voice. So what causes dysarthria? We listed a few on the PowerPoint. To name a few, a stroke, a brain injury, or a tumor. So some symptoms of dysarthria include, as I mentioned, slurred or mumbled speech that is difficult to understand. It can be slow or fast speech, immobility of the tongue, lips, and jaw, and robotic, hoarse, or breathy quality of voice. So what is the role as SLP? It is in our scope of practice to help those gain communication skills after they are impacted. Dysarthria is no exception. It is a complex motor speech disorder, and every individual presenting with dysarthria has unique needs. Therefore, this will require the speech pathologist to strategize and individualize treatment plans to address the specific areas that are affected. It does depend on the severity of the impairment. According to ASHA, there are some possible here are some ways that an SLP can help a client with dysarthria. For example, they can help you by slowing down your speech if you have a faster rate of speech, and also using more breath to speak louder. Often those with dysarthria lack that breath support to sustain what they are saying, and overall strengthening those muscles and muscles of the mouth, and using other ways to communicate like gestures or writing on a piece of paper, but that's only just until an AAC system would be implemented in therapy. So some helpful tips include checking in with the listener to make sure that they understand you, trying not to talk a lot when they are tired, because you will be harder to understand and you might be fatigued. Go to a quiet area where you can really listen and see the person's facial expressions and lips moving. And this helpful tip, lastly, is to inform those in your community to help spread the word about those with dysarthria. That will help SLPs and all of us together as a whole. Here are our references. And thank you. I also wanted to share what I thought was interesting. Was our resource from class. So as we know, dysarthria effects can be from the basal ganglia because that structure of the brain controls voluntary movements, and voluntary movements are what's affected when affect those with dysarthria. And thank you for listening.